Are you a parent of a child experiencing autism? Are you seeing that your child repeats certain words or phrases again and again, some making sense and some do not make any sense to you? Do you want to know what is this echolalia about and want to understand more about it? Do you believe that it's just another repetitive behavior or it can be a building block to learning language? If you want to know more about all of these, then you are at the right place. Because in this video today, we are going to talk about understanding echolalia and just exploring, is there a possibility that echolalia is a building block to learn languages? So stay tuned. Welcome back to my channel Dignity in Disability. And I'm Anuradha Deshpande, mother of a young man experiencing developmental disability. I'm also a clinical psychologist, counselor, and a special educator, and founder of Care and Care Life Skill Academy. This pandemic turned me into a digital disability life skill coach, and I brought out something called Care Life Skill Academy, which is a place where parents can educate themselves to become educators to their children with special needs and help them build skills in them so that they can lead a life of independence and dignity. In fact, it is my mission to empower 100,000 parents of children who are experiencing any form of developmental disabilities to learn and build these life skills very systematically and then go on to teach their children so that they can lead a very fruitful and dignified life. Through this channel, Dignity in Disability, I bring 2 weekly episodes of Tuesday Facts and Friday Facts. In today's Friday Facts, I'm going to talk all about understanding echolalia and how it can be a building block to learning language. What is echolalia? Whenever we talk about a person with autism, there is a common stereotype that they dwell in their own world. And one of the stereotype about autism is also that they get into echolalia, a typical behavior which serves no purpose. And once you go beyond the stereotype and learn about this communicative intent of children while using echolalia, then you will look at it in a very different way. So let us go and try to understand about echolalia. So what is this echolalia? Echolalia is a modern Latin word which means echo means repeating the sound, echoing, and lalia means language. So echolalia can be a symptom of aphasia, dementia, traumatic brain injury, schizophrenia, but it is most commonly associated with autism spectrum disorder. And today we will talk in the context of children with echolalia who are in the autism spectrum disorder. Children with autism do communicate and interact, but they do it in a very different way. Echolalia is the first way of normal communication in babies. Baby starts babbling and cooing in a very rhythmic way, and it is in fact a way of imitating our adult language. And later they go on to learn words, phrases, and make sentence and meaningful communicative language. This is called Gestalt type of language acquisition. Loas in 1981 says that echolalia is most likely not something we have inadvertently reinforced our child with autism. But he feels that it is more than likely that echolalia is something that is intrinsically rewarding to the child. And many children with autism are experts not just saying what others are saying, but they also become experts in imitating the exact voice, the inflections, and the manner in which those words are spoken. And this you can see when they start imitating the dialogues from their favorite TV serial or from a movie. The value of echolalia for the person may be that the echoed words and the contextual cues become the stored information for that person to refer for a later date as an internal rehearsal of that event. So, why do these children get into echolalia? There are several different reasons why these children keep repeating words, phrases, and sounds. For example, they may be using it as a sensory outlet or a way to calm themselves when they get anxious or upset. Secondly, it could be used as a form of communication when they find it is too difficult to process the instruction given by the other person and then retrieve the correct response to it. So if they want to buy time in the meanwhile, they just repeat it as a form of communication. The third reason, maybe they are exploring this as a form of talking, self talk, talking to oneself to reassure and calm themselves from very difficult and frustrating situations. And finally, they may be trying to take their first step to communication. Let us now see the types of echolalia. There are several different types of echolalia and each play a particular role in a child's way of communicating or learning how to communicate. But we will look into four major types of echolalia. The first one is immediate and delayed echolalia. Sometimes echolalia can be immediate, where and the child will be echoing the words they hear. For example, if somebody asks the child, "Do you want juice?" the child will say, "You want juice?" They will repeat the same thing. The child might be really responding in a very appropriate way to your answer, but since they cannot replace the original pronoun into proper pronoun and answer them, they repeat it. Echolalia can also be delayed one. So in a delayed echolalia, for example, the child hears something on their favorite TV serial or a favorite character speaking, and they later at a later date in the evening or the next day or next week or some days even much further, they will repeat exactly the same dialogue in the same way the character speaks. This is called delayed echolalia, and this happens much after they hear it. The next set is interactive and non-interactive echolalia. Children speaking in an interactive way are trying to communicate with another person from a real life situation, but the challenge is to find out the meaning. For example, they might have heard in a commercial saying that, "Got Coca Cola?" And when they are thirsty, they will ask, "Got Coca Cola?" May not be necessarily asking for Coca Cola, but they know that Coca Cola can quench thirst. So they ask it. But it's many a time, whoever is listening, the caregiver or the parent or a teacher, they cannot make the exact meaning out of it. So, as a listener, it may be very baffling and confusing at first. But when you try to understand how the child has come to know these terms and in the context, then you can find meaning to it. In non-interactive echolalia, the child is not speaking to anyone, but is repeating a certain set of words or phrases again and again as if they are practicing it. And it may be not used for the purpose of communicating something, it may be used as a calming mechanism. So, in either case, in the first case or here, they are still using the borrowed words of somebody else and they have to replace it with their own words here. So, tapping such echolalia patterns will be very, very useful to parents, caregivers, and all speech and language pathologists, speech therapists to build the child's unique style and work towards original formation of words and sentences or language. Then comes the third type of echolalia, that is mitigated echolalia, in which the child makes small changes to the original phrasing. So, for example, if you ask a child, which juice do you like? Initially, they might just say juice, but over a period of time, they would have learned something on a commercial and they say, yummy, delicious mango juice. And over a period of time, they will drop the yummy, delicious and they will simply say mango juice. And that is mitigated echolalia for you. So, these are the different forms of echolalia. So, from whatever we have seen so far, echolalia appears to be a normal step in a child with autism's cognitive and language maturation. In short, they use echolalia because it works for them. So, the question is whether we should get rid of this echolalia. The answer to this may be that teaching the person another and more efficient way to fulfill the purpose served by echolalia. So, is intervention required for echolalia? The presence of echolalia has actually been identified in a very positive sign in a person with autism. Like Loas, he found that the presence of echolalia is an important prognostic indicator that the child will have language growth in future. So that is why echolalia can be a stepping stone to learn language. So let us see how we can convert this not so original way of speaking to more constructive way of speaking a language. So echolalia, or as we all know, serves many purposes. It may be a response to distress, to support concentration, for enjoyment, or with a communicative intent. For the context of today's topic, we are seeing it as a building block for language and communication. So in that context, there are some strategies and tips which can be helpful. So the first step towards it is to have a complete comprehensive language assessment of your child, and then you can start with this intervention method. Once you understand the level of functioning of your child, then there are certain strategies you can use where you can meaningfully convert these echolalia into a future language and communication process. So avoid responding with sentences that will result in echolalia. For example, if you want a response of I am thirsty from your child, instead of asking do you want juice, you would say I am thirsty while pouring the juice. So that way the child can relate to it, and the next time when he's thirsty, he will say thirsty. Teach I don't know technique. That is, teach the child the phrase I don't know to set of questions the child really does not know the answer. And a research conducted in 1978 indicated that once a child learned to say I don't know to one question, he or she generalized to other questions for which they don't know the answer, but at the same time they correctly answered the questions for which they knew the answer. For example, for several questions which they don't know, they might answer I don't know. But when it comes to questions like what is your name, they will promptly answer their name. So over a period of time, they will know which are the questions where they have to say I don't know and which are the questions they can answer. This will give a natural process of communication. Then the third method is teach the correct response to questions immediately. What is a rose? A flower. A flower is a prompt, and this prompt has to be faded over a period of time. The next one is to use a starter question like I want, and give a pause. And maybe you can show some postcards as a cue, and the child will fill in the blanks. The next method is to use another person as a model. So you ask some common questions, and when the model gives proper response to them, you reinforce them and give positive feedback to them. And immediately ask your child the same questions, provide prompt if needed, and reinforce the child for correct response, and fade the prompt and reinforcement gradually. Respond to communicative intent. If your child is trying to communicate, then you should positively respond to them. So when you ask, do you want water? And your child is repeating it, do you want water? But at the same time reaching to the glass of water or the jug of water, then what you have to say is call out the name of your child and say, for example, Smita wants water. So that child will repeat that. So we saw some tips and strategies how this echolalia with a communicative intent can be directed towards enhancing the language and communication process of your child with autism. Echolalia serves many purposes, and just concentrating on speech alone is not going to help. So you should have a very comprehensive program to address their oral sensory needs also, along with speech therapy. And still, if the child is not able to speak, you should consult a speech and language pathologist who will work in a wholesome way with your child. So echolalia is not all bad. It's the way you look at it. Since it is serving many purposes of your child, you should know how to manage it in an effective way that it will benefit your child in the long run. So that's all about echolalia in this video. And if you like this video, please comment, share, and like this video. And also subscribe to my channel Dignity in Disability so that you will receive all future notification whenever I upload a video on my channel. Please also be a part of my exclusive Facebook community. The link to it is given in the description box. And if you want to know more about Care and Care Life Skill Academy, then please go and explore my website www.anuradhadeshpande.com. So that's all from Friday Facts, and I will see you next on Tuesday with another skill building program. Until then, goodbye and take good care of yourselves. See you then.